All right, good afternoon, guys. It's Jeremy with the Hospital PT. I'm back again with another video. This is the title of this video is called "The First Night at Home: What Most Families Get Wrong, or What Most Families Miss about the first night at home." And so, you have to excuse me if I look like I'm sweating a little bit. I'm just got off work here at the hospital and about to go into the gym, and so I figured that now would be a great time to sit in my vehicle and record this video. So bear with me as we work through this. Okay, so first night at home after the hospital. Okay, first night at home. That is when many patients run into their highest risk of falling. And I know we talked about the first 72 hours, and that certainly is key. But that very first night is when things really start. That's when the rubber meets the road, so to speak. It gets real. Okay, the fact that you don't have anybody there with you, or you may not have anybody there with you. Even if your spouse lives in the home with you, they may be sleeping, or they may be sleeping in another room, depending on what the arrangements are, and so on and so forth. So that first night can be very tricky and very daunting for a lot of patients and their families. And it's not because. Most of the time, it's not because of carelessness. Okay, it's oftentimes related to how significantly different the first night is at home versus being in the hospital. And we've touched on this in several videos about how much supervision you actually have in the hospital, even though the nurse isn't always at the bedside every minute. More like every hour or so, and you have the patient care tech coming in to change the linens or maybe help you go to the bathroom, and it's difficult to appreciate how frequent it is until all of a sudden it's not there. So I hear patients say this all the time when they come back into the hospital after a readmission. We see families say, well, we didn't realize how difficult it was going to be. Okay, we didn't realize how much help they truly needed. And that's one of the reasons for these videos, is to try to help patients and their families think through these issues the first time, right? And so that you can start to hedge your bets against having to experience a scenario where, oh no, we're at home and things are a lot more difficult than we thought they were going to be. And so why is nighttime risky? Okay, some of this is common sense. Okay, it's dark, waking up from sleep, and so on and so forth. But some of the other things you may not kind of appreciate readily would be vision. Vision is impaired not only because it's dark, but because when you're waking up from sleep, it takes you, for the best of us, it may take us 5 minutes or so to kind of get our bearings and really feel like we are ready to address the day or take care of whatever we need to take care of. It's just that when we're younger or unimpaired, we can compensate for that, wiping my eyes while I'm sleeping and walking to the bathroom. We can compensate for that because our nervous systems are intact. We haven't been in the hospital for 5 to 7 days, maybe longer. We haven't been infirmed, going through surgeries or some sort of significant illness either. And so we can accommodate the mobility needs and demands of getting up to go to the bathroom in the middle of the night. And so vision decreases, reaction time slows. Okay, that happens as a result of aging, just by default. And then at nighttime, when you wake up, it takes you a minute for your body to be able to assess the environment and make adjustments. So so you don't hit the end table or run into the dresser or anything like that. So reaction time can slow. Blood pressure fluctuates. This is a big one for a lot of folks that are experiencing polypharmacy, where they take multiple medications. We know that blood pressure and hemodynamics, so what your blood does at different times, that can fluctuate with when you're sleeping or resting or active, and so on and so forth. And those fluctuations are somewhat normal, but sometimes those fluctuations can be very significant. And if someone's blood pressure drops too quickly, too soon, you get dizzy. And many of us have experienced this and maybe didn't know what it was, is that when you get up real fast after you're startled and you wake up, somebody wakes you up, and you get dizzy, and it takes 15 seconds to resolve, that's what's happening. Your blood pressure dropped acutely, you get a little dizzy, and then most healthy normal individuals have mechanisms in their body that help compensate for that in a very short amount of time. Well, certain disease processes, certain medications may impair that, and so you can get significant blood pressure fluctuations that can affect someone's stability when they first get up, especially at nighttime. And then a classic one is, a lot of times confusion can increase at nighttime. And the kind of anecdote that I give to patients and their families is this: have you ever been on vacation and you wake up, you're sleeping really hard, maybe really good, and you wake up and you don't know, for probably 5 to 10 seconds, you don't know quite where you are? That's akin to, as we progress in age and as we start, if we have to take significant medications and we spend time in the hospital and our bodies are kind of in disarray in general, well, you wake up you spend a week in the hospital, you wake up at night, and maybe you think you're still in the hospital, and so you're a little bit disoriented. And there are a bunch of kind of ways that can look. So confusion can increase as well, and that's why nighttime can be so risky. And so a key clinical point here is that hospital-associated deconditioning and nighttime disorientation all kind of can create a perfect storm to make mobilizing at nighttime very risky, and the fall risk can increase significantly. Okay, so here's what typically happens. Okay, and we see this story a lot. Patient wakes up to use the bathroom. They don't want to interrupt anyone or wake up their spouse or their daughter or the caregiver, because they think in their mind they should be able to go to the bathroom by themselves, because before they got sick they were able to do it, and they want to maintain some of their dignity, so they don't ask anyone or they don't wake anyone to ask to go to the bathroom. And so they try to move and go to the bathroom independently. Okay, their balance is worse than they expect. They may, their vision is impaired. Maybe they don't have the appropriate lighting in their home, and they walk 10 or 15 feet, they trip over the rug that is leading up to the bathroom, or hit the edge of the nightstand, or what we see a lot is they go to swing their legs out of the bed, go to stand up too quickly, get dizzy, and their legs give out, and they try to pass out and they fall. Okay, and that's when it's scenarios like that, and that's when the falls happen. Okay, for sure. And so and research bears this out. Okay, a large percentage of falls occur during bed to bathroom transfers. I know in our hospital we have started to track the reasons why patients fall. So if they fall and they're able to articulate what was going on, a significant portion of them say that, well, I had to use the bathroom, I pressed the call button, nobody came, or they didn't come quick enough, and so I got up to go to the bathroom and I fell. So many times patients overestimate their ability. Okay, if you've ever had someone that's been in the hospital for any significant length of time, you maybe you've come across this fact that excuse me, patients often think that they can do more than they actually can safely. Okay, so patients often think, well, I walked in the hospital, I was able to do it there, I don't want to really bother anyone, I'm only 62 years old, this shouldn't be happening to me, I should be able to get up and go to the bathroom by myself. But what they don't often account for is the deconditioning that they've experienced, the fatigue that will set in, how pain will cause unpredictable changes in how they move, and how medication, especially if they've had new medications started, how that may affect their ability to tolerate, moving around like they were accustomed to prior to going to the hospital. And so when their ability doesn't match, when their actual ability doesn't match their perceived ability, that's when things can get really dangerous, because they're going to be tempted to do things that they're not equipped for. Okay, so how do you prepare as a patient, or how do you prepare as a caregiver to deal with these risks? Okay, number one is set up the environment. Okay, set yourself up for success. Clear the paths to the bathroom. Pick up rugs. Make sure everything is as open and accessible as possible. Add night lights. Make sure vision, the visibility around the room is accounted for. Okay, use grab bars, raised toilet seats, other types of adaptive equipment to set up the environment for success. Okay, that's number one. Number two, plan for assistance. Okay, will someone be available to help overnight? Encourage the patient. If you're a caregiver, encourage the patient, please call if you want to get up to the bathroom so that we don't have an accident and have to go back to the hospital. Okay, if there isn't anyone to be present during the night, then we may need to and you notice as a caregiver that, hey, I'm not here during the night, I'm here during the day, I can't be here at night, but I have big issues with feeling that they're safe to move around. If that's the case, then you may need to address that with the primary care doctor, or if that's a good thing to consider prior to discharge from the hospital, is to make sure that the particulars about who's going to help when, and if there's going to be help overnight, is there going to be 24/7 help if needed. Having all those questions answered prior to discharge is super helpful. If you're already at home, then you may need to talk about your concerns to the patient's primary caregiver, okay, or primary care physician, so that they can be accounted for and addressed. Okay, maybe home health services come in and can help provide some answers to those types of situations. Okay, number three, set expectations, and this is a big one. Be very clear with yourself if you're a patient, and if you're a caregiver, be very clear with the person you're caring for to not get up without help. And we reiterate this even in the hospital. We say, we would rather you call for our help and let us come and at least supervise you. That way, if something happens, someone's there to make sure that there's very little collateral damage. If you do pass out, we can help you to the floor to prevent some sort of other more significant injury as a result of falling because of passing out. Okay, so the next thing is use equipment properly. Okay, keep the walker or the cane within reach. Make sure the bed is at the appropriate height. If the bed isn't at the appropriate height, do we need to sleep in a different room? Do we need to sleep in a recliner for a little while? Do we need a bedside commode? Would that prevent the feelings of needing to rush to the bathroom? And all of these things are worth considering when it comes to the equipment you have available to you. Okay, so let's go through those again one more time. Number one, set up the environment. Number two, plan for assistance. What type of assistance will be present, and when will it be present? Number three, set expectations with the patient. And then number four is to use equipment appropriately and safely. Okay, so that moves us on to section number 5, and that's red flags, or warning signs to watch for at night. One is confusion. We covered that earlier. A refusal or an apprehension to ask for help. Okay, so the other X factor here can be, I'll just say it plainly, some patients can be stubborn. Okay, their pride kind of blinds them, and they will not ask for help. Okay, and and if you saw my video on the warning signs to be aware of, obviously, any significant increased weakness that you notice that wasn't present in times before. Okay, so if the patient was, in the hospital, able to move around pretty well, getting up with just someone kind of around for supervision, and all of a sudden they're needing physical help to get out of the bed, physical help to stand. Their stability when they walk is worse than when they were in the hospital. That's worth notifying a healthcare provider. Okay. All right. And that wraps us up for this video about why the first night can be so risky. Okay, I can't overestimate it enough and overstate it enough. And it's just because I see it every day, guys. I really do. And I see, families come in and say, well, we didn't know that it was going to be that difficult. They needed more help than we thought they did based on how they were doing in the hospital. And so that's why I said it a million times on these videos. Consult with the rehab professionals in the hospital. Ask for a therapy consult if you haven't gotten one in the hospital, because part of our job is to help tease out some of these details and help families and patients and families think through these issues that may become a problem beyond their hospital stay. So that wraps us up for today. As always, remember, you can't go wrong getting strong. So stay strong if you are strong, get strong if you aren't strong. And until the next video, we'll see you then. Okay, you guys have a good afternoon.